Okay guys, this video has to do with low back injuries, something that happens with active people. I want to go through in our experience what we have seen happen with folks and typically how it works. So I call this one the Hiroshima effect, meaning when the bomb goes off, there's different effects the further away you get from the bomb site. And this video specifically has to do with the disc slip, meaning that the disc slips out, creates havoc, slides back in again, does not create permanent change in the athlete. Sometimes it happens in deadlifts, a lot of times it happens in the overhead movements. And what happens is typically somebody will say, ooh, wow, it feels a little tight after that last set. Anywhere from 20 minutes to an hour, 2 hours later, they are incapacitated. They are on their back. I am unable to move. I am in so much pain, okay? Usually people know, once again, this is commonly coming up in videos when we're talking about what happens to people here, is they'll know if they need to go to the doctor. A majority of people feel like, my back is out, it's nothing that major, it's a disc slip. Without an MRI, there is no medical professional who can diagnose it anyway, and they are laid up. 2 to 3 days, they are on their back, laying on their back, with their knees up at 90 degrees, alleviating as much pressure on their low back as they can. The body immediately goes into the absolute definition of fight or flight, meaning that what happens to the area of the disc slip, the body goes completely into flight. Everything goes into an amniotic state. The area fills with fluid, you feel pain. As long as you don't move, it actually doesn't hurt that much. And the patient, the athlete, the person that got this injury is just laid low, and that area, literally you don't feel anything in that exact area. What you get outside of that bomb going off, the radius effect, would be the areas that go into complete fight. And what I mean by that is all the soft tissue that surrounds that disc slip that made contact possibly with a nerve root, what happens is they go into complete contraction and lockdown. The psoas, lumbar extensors, possibly parts of the glute, hamstring, completely locked down, and that person feels almost an inability or absolute pain in any kind of movement, twisting and turning. It makes getting in and out of a car impossible, sitting up out of bed. And what happens over the course is, depending on the severity, is what you're going to see, how long it's going to take that person to recover. So typically what we look at from something as severe as that, you're going to go out to completely recovering is sometime in that 8 to 12 week, when it's a complete slip. Okay, 8 to 12 weeks, they will be feeling pain pretty severe. When it's severe, as far as the disc slip coming out and back in again, you're looking about 6 to 8 weeks of discomfort, 2 to 3 days of Advil, possibly muscle relaxers. They're actually up and walking around. They're able to get in and out of cars with some discomfort and pain, but they are able to move. When it's moderate, 4 to 6 weeks, that means that within 4 to 6 weeks, they are absolutely back in the gym. They are moving again. They are doing stuff, staying away from bending, but protecting that area. And then when it's light, 2 to 4 weeks, they're feeling better. They will be able to do things like put their socks on. That's always a requirement before you come back into the gym. Can you put your socks on? Because essentially what's happened is that the damage is not really being done anymore in the disc area. It's literally the locking of those muscles, getting somebody in there and moving those muscles around. We do not want them stretching. We don't want them trying to fast forward the healing process. That's impossible. So this is just our protocol. We ask people, okay, what case are you? Where does it feel? You should be either laying down in bed, taking lots of Advil every 4 to 6 hours. You should be putting your feet up. You should be resting, and then slowly starting to move as you feel the ability to bend, twist, and turn. Okay, guys, thank you.